Okay, thank you very much, Dr. Chana Jaisana. And now we have already many, many questions waiting. So let us start a question for Dr. Bahadur. This is a question from UK, Dr. Fatima Hussain. Now, should men take antioxidants and try to protect themselves during the pandemic, especially whilst they're trying to conceive, and will this be useful even, not only for the COVID, but, there's also the vaccination issue that you mentioned, so could you elaborate a bit on that, please, Dr. Badu?
Sure. Thank you, Dr. Fatima Hussain, for that question. In our clinic, our nurse puts just about everyone on antioxidants at the time they join. So this is for us fertility investigation patients. And as you know, we have one of the highest success rates in IUI, but that's not the main reason. It's just one of the factors that contributes, hopefully, to the outcomes. So in relation to the COVID situation, I think men, women should be eating healthily, or if there is a deficient in their diet, then they should be taking supplements.
Okay, thank you for that. And a follow-on question would be this question about vaccination again. Can vaccines alter the sperm quality? I mean, this is a question that has been asked.
Many times. Quite right. It's a controversial area because when you look at basic principles, and I like to work from basic science onwards, and what is the science saying is that when you have a vaccine, you are eliciting an immune response. And when you're eliciting an immune response in your body, then it offsets other things. Now, I think just about everyone I know who has had the COVID vaccine has had some sort of side effects, such as, temperature, fever, mild fever. And we know that when we have those sort of mild fevers and sweats, the sperm is likely to decline.
Absolutely.
But the thing is, nobody's actually pinpointed the sperm quality at the point of the vaccination. Now, there's recent data that comes out in Fertility and Sterility, and basically the answer is that it makes no difference. And in one paper, it actually, when I looked at the data carefully, it actually, the sperm volume, the count, motility, they're all increased after vaccination. And I thought to myself, how can it be possible, even if you did not take that vaccine in that period of time, it is, not possible, although they concluded there was no difference.
Well, it could be a protective effect in any case, sort of because preventing the infection, let's say, and, this COVID infection you mentioned, can have a lot of these kind of inflammation and there's also a lot of data suggesting it creates local ischemia, for example, isn't it?
Yes.
This could be another mechanism, isn't it, and then again, here, these antioxidants, carnitines, could also play a role. What do you think again?
Sure, if you're taking antioxidants continuously and excuse me, and along the period that you're taking a vaccination, I think it could help you generally. So we have no data to show how, but yes, it is plausible for the sperm quality to be protected, as well as the rest of your health, for that matter.
Oh yes, absolutely. I'm not sure if Dr. Chana is still with us, but there was a question for Dr. Chana. That does NHS use DNA fragmentation as a, what do you say, as a tool for looking at sperm quality whilst you are looking at, even people with or without infection, let's say with the COVID infection. I don't know if he's here with us yet. Maybe Ghulam, do you have some idea if, DNA fragmentation could be affected by, the vaccination or the, more probably the COVID infection?
Certainly, I think when you look at the bigger data, let's just step back from the vaccination and look at what happens during the actual infection.
Yeah.
Is that the stillbirths and the miscarriages are very high.
Yeah.
And so if we track back as to who had it, did the woman have it or the man have it, then we can begin to tease out the contributing factors. And I wouldn't mind betting you that the sperm is very adversely affected. And I've shown you pictures already as to the sperm quality is there. That's a really good bit. And also the shape of the embryo following infection, COVID infection. With regard to vaccination, we're looking at there are two things that I need to talk about. One is, at the point, would you want to achieve a pregnancy at the time of vaccination? And again, remember, there's very fine tuning of the immunology for implantation. And yet, at the time of vaccination or at the time of COVID infection, in the time of COVID, you're actually throwing cytokine storms around. Which may affect the implantation of the embryo. And so I'm very, very surprised when all these people are saying, absolutely, there's no problem, no problem, no problem, when I think that on just scientific basis alone, it doesn't add up. In terms of vaccination, again, at the point of vaccination, would you attempt to achieve a pregnancy? My initial thoughts are to avoid it, and yet all the data that we are being fed through the NHS is simply to say there is no problem, but they're not sort of basing it on any evidence. Because I can understand, because we actually have a priority to save lives. And I think this is more important, perhaps.
First thing is you have to save the life, but secondly, you have to create life as well, I guess, isn't it? So following on we talk about vaccination, we talk about COVID infection, and now there is also this long-term kind of COVID effects remaining, and a lot of people suffering. Like, let's say there is a dysfunction in the immune system or, I don't know, muscular system. They generally have, it's not yet clear, but it seems like something similar to chronic fatigue syndrome or myalgic encephalitis. Or it's like a combination of all these things, and patients suffer long-term. And do you think these patients will have problems in their fertility, male or female?
I think this long-term, I think what has been loosely been termed as long COVID, I think the damaging effect is actually quite bad, because in the period of the infection, what is it doing? It's actually causing deprivation to many of your cellular, at several levels of your body. So here you're having deprivation of oxygen, as a result, and also at the time of infection, you're getting white blood cells, which are throwing out what you call free radicals, damaging tissue. And so you're right that we need to protect these tissues with antioxidants. I think that will help to some extent. But to think that, the long-term damage is quite bad, actually.
Because there are some papers coming out suggesting that, like even carnitine can affect the ACE2 receptor. It can reduce ACE2 receptors. If we reduce ACE2 receptors, as you showed, that these are the pathway by which these viruses are entering into the cell and then causing problems. So maybe, like compounds like carnitines and also like vitamin D, other antioxidants have been shown to protect really against the COVID effects per se. So maybe, it's still early days, but what do you think? Would that be useful for as a mechanism to target for, let's say, not just to improve fertility, but just general health, with these kind of compounds?
Yeah, I think you're absolutely right. I mean, as I said, our nurse puts everyone on antioxidants.
Yeah, indeed.
At the time that, I mean, we're not for, but I think in terms of general health, it helps, but also any damaging effect, and especially DNA fragmentation.
Yes.
If that can be overcome, and remember that we are getting one of the highest success rates in IUI at the North Middlesex Hospital in London.
Yeah.
And we have been consistent. It's just not a one-off. It's year after year. So yes, I do believe in antioxidants. But I think Chana has joined us by the looks of it.
Ah, yes, okay. Hi, Chana.
Hello. Had some technical difficulties joining, but I'm sorry I'm late.
No problems. There was a question for you before. Dr. Bahadur also answered some part of it, but could I ask you the same question as well? I mean, what are your thoughts on how vaccinations and COVID is going to affect sperm quality, not just immediately, but also in the long term, and how we can try to antagonize this problem?
Yeah, of course. I mean, there's clearly lots of uncertainty, and there are reports emerging. It would not surprise me, and as with other viral infections such as flu, as to having a temporary reduction in semen quality. The question is about long-term effects, and we need robust data on that. So that's, to my mind, lacking. But as with all things, the emerging pathways appear to be, DNA damage and oxidative stress appears to be a common, important sort of throughput points. So infection, metabolism, aging, all of these things can affect things, but there seems to be this common highway of antioxidants which seems to be emerging, which is very important.
Yeah, indeed. Because inflammation seems to underlie a lot of these problems, and inflammation is then what's causing this ROS increases and all this kind of stuff. And then it could be something to target, I guess. And not only is it going to affect DNA fragmentation, I assume it's going to affect aneuploidies, also embryo development at that point, and as you mentioned, recurrent pregnancy loss, right?
Yeah, which is obviously an unstudied but very emotive, very emotionally draining problem for couples. And it's good to study things like that because it's the tip of an iceberg, and it's a continuum of some cases of miscarriage, and Gulam treats people with infertility as well. So yeah, I mean, there are lots of unanswered questions, but I'm sure that as with any other forms of fertility problems, antioxidants and oxidative stress are sort of right in there in the mix, and things that really need to be looked at in more detail, certainly.
Yeah. There was another question for you that do you use routinely DNA fragmentation within the NHS setup, for example? Or
yes, that's something that we have an ambition to do. So we at Imperial, are setting up an assay, and we are working to try to get this offered on the NHS at an affordable price for centres that refer. I think that would be a big step forward because we know that there's a lot of variability with other factors such as morphology. I think that would give us a lot more granularity and power to sort of identify people who might most benefit from targeted therapy.
Absolutely. Yes, thank you very much, Dr. Chana Jayasana. And thank you very much also, Dr. Ghulam Bahadur. And, we have many, many questions still, and hopefully we will answer them all bit by bit. And thank you everyone who's been attending this.
Thank
Hope
you.
to see you all soon. Okay. Thank you very much. Bye.
Bye.